Assalamu alaikum. Okay, so today we are going to discuss about the risk assessment. In the last classes, we were discussing about the biosafety levels, and then we came across the biosafety cabinets, the classification of biosafety cabinets. Now we're left with two more topics: risk assessment and packaging and transportation. So I'll start with the risk assessment. Now, what do we understand by risk assessment and how this risk assessment is important when we work in a lab or when we work in a biosafety lab? So always, whenever we talk about risk is something that we foresee or we see that what could happen if the procedure which we are using in the laboratory, uh, what are the potential risk for this for the practices which we do in the laboratory. So risk assessment is a very important uh, thing to see whenever we are working in the lab, and this whole responsibility goes on the lab, the people who are working in the lab, and particularly the supervisors, the director of the labs, and there is a whole committee that manages and makes the risk assessment before anybody starts to work on any project. So if we talk about risk, then we face two types of risks. One would be a biosafety risk and the other would be a biosecurity risk. Now both of them are different in a way that when we talk about the biosafety risk, then we are talking about all those outcomes, all those consequences that could happen whenever any person is working in a lab. That whenever he's working, it could be a threat to the individual himself, to the people other people who are working in the laboratory, or to the people who are present outside the lab, or it could be a potential risk to all the humans and the animals outside the lab in the community. So there is always a potential risk of infection or the dissemination of the infection whenever any person is working with a pathogenic agent. Now, naturally, to assess this risk, we should categorize or we should classify the uh, agents or organism on the basis of their risk which they provide. So some of the organisms provide a very low risk, low level of risk, or a moderate level of risk, and some of them provide a very high level of risk. And naturally, we need to make more risk assessments for those organisms which provide a very high level of risk. Naturally, if these organisms get disseminated or they are spreading in the infection after they have been used in the lab, so it would be definitely very difficult to get hold of these organisms or to control them, because all those organisms which are providing a high level of risk are those which are the pathogenic one, with the most pathogenic one, against which we do not have any treatment available. We do not have any vaccine available. So naturally, these are the organisms or the agents for which we need to work at the highest level of containment, that is the VSL level 4 agents. Whereas all those organisms which provide a low level of risk, even if they get disseminated or they come outside the lab or they infect the person, then there's a very low level of risk because we have treatment available, or maybe the person is immunized or vaccinated against that pathogen. So again, when we talk about the biosecurity risk, we talk about all those consequences, all those things which could uh, be faced if there is any malicious release of that agent. So if any person inside the lab or outside the lab who is an authorized person who is working on that pathogenic agent maliciously, or I mean he these usually biosecurity, we use this word for against bioterrorism. So any person who misuses the agent for any malicious use, then naturally that would provide a high level of risk in case of the release of the organism. Okay, so okay. So we need, for the risk assessment, we need professionals to make such risk assessment. Committees are there, and the people who are involved in such committees to make risk assessments are the biosafety officers and the people who are responsible for the lab, the supervisors, the director of the lab, the person who himself is working. Because first and foremost, that the person who is working should be a very a professional and a proficient microbiologist, or he should have a good hand over working and using a number of techniques so that that organism is not released into the environment. See, there are two ways in which the organism could be released into the environment. Either the organism is deliberately released into the environment, that would be a malicious release, or it could be a the person is not knowingly, if the techniques are not used properly, if the person is not working according to the SOPs followed in the lab, so that organism could be released into the environment. So one is a deliberate release, and the other would be not a deliberate release, but it could be released due to not working properly in the lab. Okay, so those people who are responsible for making these risk assessment have to be familiar with the proposed work activities. Means whatever work is going in the lab, those lab professionals should be knowing that these are the techniques followed in the lab. The person who is working is a proficient, in his working, in his methods which he is using, and the equipments which are being, what type of equipments are being used. See, we could not work at a very high risk, with a high risk agent at a low level, but at a biosafety, lower biosafety level. So that is the reason that we should have a risk assessment committee that sees all these consequences, that what could happen when any person is working in the safety labs. So this committee should be reviewing all the activities associated with the infectious material, including the work activities, the person who is working, under what condition that agent is being stored, or whenever that agent is being transferred or transported from the lab, either in the lab from one place to another, or from one lab to another. Transportation is also required, so it should be seen, or the any activity that requires destruction of those agents. So all these activities could be having a number of risks associated with it. So that is the responsibility of the biosafety officers, to look after that it will not release the organism into the environment. Now here, when we see the laboratory acquired infections risk association, a number of things are kept in mind. That is a history of the lab acquired infection. So that could be often due to some carelessness or poor techniques. Like I was telling you, that whenever any person is working in a lab, that person should be proficient in his working. He should be knowing his work, and he should be following all the SOPs of the lab. So that person is always kept on watch, that whether he or she is working with proper techniques, with careful techniques or not. So there are very few cases we can attribute to direct accidents like mouth pipetting or using sharp injuries. And but sometimes infection could be caused due to exposure to the airborne pathogens, which is generally presumed to be the cause of a number of infections. So like we've talked about when we're talking of the biosafety levels, we were talking about the aerosol being generated or number of techniques that can generate aerosol. So we minimize the use of those equipments that can generate aerosol. And that could cause a number of infections, especially the respiratory infections, which are easily acquired. So we have witnessed a number of sporadic infections in history, back in 70s, back in 50s, 90s, and one which we are right now witnessing. Everybody knows about it, and there are a number of you can say thoughts or school of thoughts about this pandemic, that whether it was an indirect, you can say a deliberate release of the organism, or a deliberate, this pandemic was a deliberate, was done deliberately, or it was maybe due to any accident in the lab, or accidentally it was acquired in the people, and then it spread from one country and all over the world. So it could be a malicious act. Sometimes I mean, people do use these acts or these agents to release the organism, and we all know that in these times a number of countries do I mean want to you can say ruin the economy of the others, and for this they could go to any heights. They could even use bioterrorism. They could even use a malicious act to release the organism so that the country's economy is destroyed. So all these risks associated with biosecurity. So bioterrorism is one of it, and bioterrorism has emerged as a threat to the international security. So we have seen a number of attacks, a number of accidents. We have also seen a number of deliberate release of organisms back in 80s, where there was a Rajnishiri religious cult attacks, or 90s. We have another attempt of this sort. We have an anthrax attack. And then there are illicit acquisitions as well. And these illicit by these we mean that a number of people have collected infectious agents, or they have ordered these infectious agents from the places where they have to spread the infection. So there was a Clostridium botulinum spread in 90s when it was ordered by a person from a pharmaceutical company. Then there was a Yersinia pestis ordered, which was also spread for and used maliciously for bioterrorism. Then there was another use of Shigella to spread infection in the co-workers. So these are all illicit acquisition, means the organism was not ordered, not purchased in order to work on them, but rather these were purchased to spread the infection. So there are a number of cases organism could be used maliciously or wrongly, where it should not be done like this. So we have to foresee whenever, now these days a number of acts have been passed or have been made, that whenever any person orders any organism from any country or any pharmaceutical, it has to provide all the documentations that for what purpose that organism would be used, where it would be used, and what is the project under which they are working. So every official document is to be provided. Even whenever any person is working in the lab, also that person has to defend his project, and then he would be given the permission to work on that project. And that is all about the risk assessment. So the project is, whenever we write any project or whenever we run any project, we have to get approvals from the bioethical committee. And the people in those committee would be deciding on the basis of the written documentation, whatever methodologies you've written in this project, they will decide that what type of organism you're working on, what techniques you will be working on, who are the people who are working, whether they are, I mean, they will be using the standard protocols or not, and in which circumstances the work would be done, at which level the organism would be worked on. All these things are given in the written documentations, and then they are approved. So if there is any slight chance or they see a slight risk in the work which you have proposed, so you will not be granted permission, and that project would not be approved only because of the risk. So we have to, whenever we go for writing or winning any project, we have to propose that project in such a way that it does not allow any risk when we work on that project. That is how we can get approval to run that project. It's only because of the risk assessment. So this is that is why we say that risk assessment is important. So here, whenever we do the risk assessment, then first of all, we need to characterize that biological agent on which we are working on, right? So if any biological agent has, is less pathogenic, then there would be minimum risk associated with it. So we need to evaluate that pathogen, okay? So we need to evaluate if we know if that, everything about that organism. Well, how we know everything about the organism means that organism is properly characterized. If the organism is characterized, then we know that which disease it may cause. We know the virulent agent of the organism. Then we also know that whether the treatment is available or not, whether proper diagnosis is available for that organism or not. We also know that whether vaccines or immunization is available for that organism. So if that organism is properly characterized and we know so much about that organism, then this means that it is providing a low level of risk. Okay, so first of all, we need to characterize the biological agent hazards and the laboratory activities. We also need to evaluate which laboratory activities would be going on whenever we are working on those organisms. So all those procedure hazards. So let's suppose we are working with sharp items, then naturally we need to work in such a way that it would not be leading to the release of the organism. Maybe it would not be infected the person who is working with. As I told you that whenever the agent is pathogenic, then we should be using all those equipments that do not generate aerosol. Like if you're using a centrifuge, it should be a completely closed centrifuge so that it's not generating aerosol. So all these require, all these techniques could be associated with procedure hazards. So we should evaluate the laboratory procedure hazards. Then we should also see that we determine how the various adverse scenarios could occur. So that is how we should foresee that if this procedure is being followed in the lab, this could be the possible consequences. These could be the accidents associated with it. There could be a spill, there could be a drop, there could be an inhalation. So we should be prepared for all these unforeseen accidents or adverse scenarios that could occur. And sometimes, even if we assess all the risks associated with it and we make risk assessments and we make a guideline to follow, but still we face a number of other accidents which we have not thought of. So we need to again review our risk assessment after any new accident has taken place which we have not thought of in the lab. So every time the risk assessments which are made in the lab are reviewed and they are changed according to the work which is being done. So we characterize the risk, we evaluate the potential for the consequences of each scenario, we determine the acceptable and the unacceptable risk. So we know that the acceptable risks are the ones which we can manage and which we know, and some of the unacceptable risks are the ones which we do not foresee and they could take place, and what would we do if such hazards take place in the lab. So the procedure hazards involves, whenever we are working in the lab or when we are working on any project, there could be two ways we could work on that agent inside the lab, or sometimes we do require some field studies. Sometimes we need to use, after all the lab characterization, we need to work on that organism in the fields. So when we work in the field, outside the lab, whether that organism would provide a high level of risk or a low level of risk. Then if you're working on animals, naturally if we're working on animals, then we need to keep a control environment. It should not be spreading infection in other animals, or maybe if we're working in the fields, it could not spread the organism should not be spread into the environment. Then a number of hazards associated with the procedures which we are using. As I already discussed, that we should not use all those procedures that generate aerosol equipment, especially the centrifuges, the homogenizers that could generate aerosol, or the needle and the sharp items that could release that organism, or that could, by which the person who is working could acquire the organism, or the pipettes if we are using mouth pipetting, which is prohibited now. So sometimes risks are also associated when the person who is working is suffering from some deficiencies, especially if the person is immunocompromised or the person is immunosuppressed. So, or maybe that person is not immunized against that agent. So that would be providing a very, very high level of risk while working. So deficiencies in the host defenses, that could be a pre-existing medical condition. Maybe that person is already immunocompromised. Secondly, maybe due to pregnancies or allergies or mutagens. All these conditions may lead to minimizing the host defenses, and naturally if the host defenses are weak, then it would give a very good chance for the agent to infect that person. So immunization status is also very important to assess for the risk assessment. Then this behavioral element is very, very important. See, sometimes people who are well trained and who are working in the lab very proficiently, but still sometimes they may not follow some routine protocols of the lab, and that might lead to the release of the organism into the environment or maybe into the lab. So behavioral elements include education, training, experience, motivation, and attentiveness. So sometimes it happens. So that is why people are kept, consciously kept under a watch whenever they are working in the lab. So that is an unintentionally, the person can do such thing. He knows everything, but sometimes we skip few procedures or few steps in the procedure just because we think that, okay, nothing would happen every time we do this experiment, and nothing happens. So it may happen someday. So we sometimes we skip these things. Like whenever you work in the lab, and if we just take our examples, whenever we work in the lab, we tell you we work in the open bench, on an open bench. So whenever we work in the lab, we say that we have to clean the bench top, we have to wear a lab coat, and we have to put on the flame so that the environment is or the air around which we are working is sterile or clean, and we should work aseptically. But sometimes what we do, we skip few of these things, and not knowingly that they are important, and at the same time, an accident may happen. Maybe we are not wearing a lab coat and a spill takes place, okay, and maybe we have not cleaned the bench top and it was already contaminated and you acquire the organism. So these are the few daily basis examples that could lead to accidents. So there are risks associated with all these work. So this is how, on the basis of all these risks, we group or we classify the agents according to the risk associated with them. So we have 4 groups, like we have biosafety levels, 4 levels. In the same way, we have 4 risk groups. And naturally, now you know very well that the group which is providing a low level of risk, that would be grouped under group 1, and that providing a highest level of risk would be group 4. Now, the group in which we say that is providing a low level of risk, now here also we categorize on the basis of whether that organism is providing a low level of risk to the individual or to the community. So if we take the risk group 1 organism, it is providing no or very low level of individual and community risk. The person who's working and the people who are outside the lab or maybe inside the lab. So it's not providing any risk to the community. Why it's not providing any risk to the community? Because it is not a causative agent of any infection, or is unlikely to cause human or animal disease. That is why we group that agent into group 1. Secondly, the group 2 organisms are providing a moderate level of risk and a low community risk. Individual as well as community risk both are moderate or low. And why it is moderate or low? Because it can cause a disease, but that disease may not be very serious one, because we do have treatment available, effective treatment available, and even we have preventive measures for that disease, and the risk of spread of the infection is limited. So that is the reason because we group these agents into group 2. So like we have these days, when you're talking about the COVID-19, that is naturally spread by aerosol, and it could be acquired easily by inhaling the organism. So the preventive measures are also difficult to follow, and no treatment is available up till now. There are some treatment supportive therapies, but not effective treatment is not available. No immunization is available as yet. So naturally, we will group it into our highest level if we do the risk assessment of that agent. Then we have the group 3 agent, which are classified under group 3, and they are they provide a high individual risk and a low community risk. So in the individual, or the person who is working is always on a high risk, but the community is at a lower risk. Why? Because they can cause a serious human or animal disease, but it is not that such a disease is not, it is not an infectious disease, or it is not spreading. So dissemination is difficult. So that is why, and also that effective treatment is available, preventive measures are available. That is why it is providing a low community risk. Then we come to the highest level of highest risk group agent, and that is providing a high individual as well as a high community risk. So both risks are high, and naturally we will group all those exotic agents which have still not been characterized. Those would become under group 4. They have not been characterized, means we do not know an effective treatment for them. We do not know, still the vaccination is not available. Still maybe the whole genome of that organism has not been studied. So that is why they provide a high individual and a community risk, because they cause serious human and animal disease and can be easily transmitted. So airborne infections are easily transmitted, we all know. It's very difficult to control them, and no effective treatment or preventive measures are available, no vaccination is available. That is why it's highly risk group agent. that is a group 4, and whenever we're working on this such agents, we should use a biosafety level 4, the highest level of containment. Okay. Okay, now apart from the characteristics of that the agent on which we are working on, the risk also is associated with the person who is working with that agent, means the host factors. So there are certain host factors that also change the level of the risk. See, if the person or the host is suffering from some deficiencies, then the risk associated to that person would be high. Whereas if we compare the risk associated with the person who is not suffering from in any deficiencies, the risk associated would be lower. So any person who is suffering from deficiencies in the host defenses, or in his immune status is low, he is not, he may be immunosuppressed, or he may be suffering from any disease in which, or conditions in which your immune system goes down, like for example in AIDS or in HIV, it attacks your immune system, or it keeps on depleting your T lymphocytes, and that would lead to a weak immune system. So naturally, if any person has a weak immune system, or his defenses are not good, so he may not fight against any infection, and that any organism who is able to cause an infection can easily disseminate into the body. Then again, people who are having pre-existing medical condition like eczema, or as we discuss about the condition, pregnancies and allergies and immunization status, all of these things we've already discussed, so I'll just move forward. So all these conditions could weaken the host defenses, and that would lead to more chances of getting infection. So we need to characterize that agent. We've done this, sorry. Yes, here. So we assess the value of the agents from an adversary perspective. Like, we should foresee the consequences whenever it's being worked on. We should see that what is the mode of its transmission, what is the mortality rate of this agent, and what is the morbidity rate of that agent, right? So what route it is being transmitted in the population, which are the host of that agent, whether it only infects the humans or it infects the animals as well, which are their host, how it is transmitted, whether it is transmitted through fecal oral route, or it is transmitted through the air, or through the blood, or through the food. So we should see its transmissibility. Then we should see that whether it's giving you a high mortality rate. Even if you see in COVID-19, the mortality rate is not high, right? The morbidity rate is very high, but the mortality rate is not high. But still, a number of people who are, again, host defenses come. Again, we say that the person who is having deficiencies in their host defenses, like the old age people who have a weak immune system, naturally, their immune system is going down. So those are the pre-existing conditions which may lead to mortality. There are some conditions which may lead to mortality, but otherwise in the healthy individual, the mortality rate is low for certain infections, especially I was just talking about COVID-19. The morbidity rate, that is the ability to cause infection in the people, whether it's high or low, whether that infection, if it's causing in the community, it's causing an economic loss to that country, or psychological loss. If it is affecting the people psychologically, now you can see under these circumstances also people are getting or have got disturbed psychologically. Then whether that organism could be used for a malicious use. Now this malicious use could be, or the organism could be acquired. The acquisition could be natural, means not deliberately, or through the lab, or synthetic biology. or during the production in a research and development institute, or covert production, or ease of storage. Sometimes storage is also very, very important. So if we are storing any agent and we do not know the proper temperature and the condition in which it is stored, then also we could be the cause of, not deliberately, but leading to any release of the organism. Again, dissemination if is very easier if it's aerosol, and again it depends upon the environment as well. So in environmental hardness. So here we have again just classified the 4 levels of the malicious risk groups into 5 types rather than 4 types. So that is on the basis of biosecurity risk assessment. So here when we group these agents according to their malicious use, we can group them into 5 types. It could be a non-pathogenic to a low level of risk, those providing a moderate level of risk, providing a high level of risk, and an extremely pathogenic agent which is providing an extreme level of risk. So sometimes people deliberately do certain acts in the lab to deliberately release the organism into the environment. Sometimes it's by accident. So it could be both ways. So non-pathogenic ones, even if they're used maliciously, they don't have any significant consequence. They're insignificant because they are not pathogenic. Okay, those providing a low level of risk, so they're difficult to disseminate. So the malicious use would have few consequences, and that could be easily controlled. Why? Because they're difficult to disseminate, right? Then again, those which are under moderate risk, they are relatively difficult to disseminate, and their malicious use would have localized the consequences with low to moderate. And the casualties or any economic damage could cause anxiety or unrest in the people. So those providing a moderate risk are categorized in this way. Then we have the organism which are not particularly difficult to disseminate, they're easy to disseminate. See, we could add any organism in the water supply if we know that it survives in the water and the route is fecal oral route, it could easily cause infection. So if there's certain organism which are blood-borne, and it could only be transmitted when by sharp items or needles or in any transfusions. So that is a difficulty because everybody is not undergoing such procedures, and it could only be transmitted if such procedures are not used properly or mishandled, right? So those which are at a high risk are not particularly difficult to disseminate, means they are easier to disseminate as compared to the non-pathogenic or low or moderate organism. Then so in this we can use the organism maliciously, and it could lead to national or international consequences. See, whenever any organism is used for bioterrorism, it is basically used to destroy uh, the country's economy. It is used to destroy the country's, you can see, the health of the population. And ultimately, when the health of the population is destroyed by any endemic or a pandemic, then it could, or any outbreak, that could lead to an economic loss. Okay, so that is done in any act of bioterrorism. So we all know that now the recent techniques of warfare include bioterrorism. So the organism which is extremely or extreme at providing a biosecurity risk would be the one would normally be classified as highly attractive, except that they are not found in nature. So there are certain organisms which are not normally present in the environment. They have been eradicated or they are not present in the environment, but now they have been deliberately or they are genetically engineered. There's certain genetically modified organism. Even people talk about the COVID-19 that is genetically modified, is not a natural one. So that could include, the extreme ones include basically the genetically modified organism. It could be highly attractive. By the word highly attractive, we mean that they could easily be disseminated into the environment. They could easily be acquired by the people. There is no treatment available or protection available for these exotic agents because they are genetically engineered and they would not be known by the people or the place where they have been spread. So they could be these organisms which provide an extreme level of risk could be easily used for bioterrorism, or they could be used to breach the biosecurity of any country. Okay. So for this risk assessment, we have security information or systems that could be targeted to facilitate gaining access to the dangerous biological materials. See, this is a very, very important thing that why we say that whenever we are working at a higher level of biosafety levels, we should be only, allowing the people who are working in the lab, means authorized people are permitted to work in the lab. And there is a strict check for the entry and exit from the lab. So when we were discussing the levels, we discussed that how the person gets into the lab and who are those people who are authorized to work in the lab. So there's strict biosecurity when any person is working at a higher level, working with any exotic agent. So everything is screened whenever that person is going into the lab. The person should be authorized. There's fingerprinting, there's a retina scan, and every information about that person is written. Even the information of the person who is supervising the lab is written outside the door of the lab, so that in case of any accident, in case of any malicious act, also you can get hold of that person. So in a number of even if we are working with or we are only allowing the authorized people in the lab, but still there are chances for the leakage of this organism into the environment. So it may be targeted to facilitate gaining access to dangerous biological materials. So sometimes the people who are even authorized, they could be being used by the other people who are having a malicious intention. They could use that person. It could be, there could be so many reasons. We all know that the people could be hired for that work. Okay, and it takes so many years to do that, because whenever any person is working in a lab, he has to gain trust of that lab. So for doing any malicious act, he has to gain access into the lab. So whenever any organism is leaked or disseminated or released from the lab, it could be the act of that authorized person, if that authorized person is having a wrong intention. So other facility assets may also be targeted, like by the political extremists, by disgruntled employees. As I told you that some people might be hired for doing this job. Maybe the lab supervisor doesn't know about it. Maybe he thinks that the person is a very trustworthy person and is working for so many years, and he will not be having any intention about this. But still, that authorized person may release that biological material or agent, and maybe stealing that agent from the lab and providing it to another political extremist. So that happens in labs, and this is what leads to this such outbreaks or pandemics which are done deliberately in order to destroy the economy of the countries, right? It may happen in facilities which are high containment laboratories and having animal facilities. Okay. So again, these are the similar type of things which we have already discussed. The elements that may modify the risk. So we have adversary classes, including the terrorists, the extremists, the criminals. All these things are different. So we have a number of extremists, terrorists who are naturally they are not the patriots of that country. They may be from another country, and they for terrorism they may use biological agent or such materials, and they're criminals who do these acts for somebody, and they're criminals. They may steal the biological agent. They may gain access. You may be seeing such things in a number of movies as well. There's so many movies made for to show bioterrorism, and there even authorized people are stealing the and how they are breaching the barriers, how they are gaining access into the lab. Even there is fingerprinting or retina scans and all these things, but still they gain the access to the lab, and they may steal or they may take or release the organism. So this happens by so many acts. It could be the insiders or the authorized people, especially the insiders. So authorized access to the facility, dangerous pathogens, and again restricted information. There's a number of documentations which are available in the lab and that are not to be released to the outside. So a lot of work and a lot of efforts have been done to characterize a particular organism. If somebody steals that information, then naturally the whole project is of no use, and somebody else takes the credit of that work. So facility management, site security, and local law enforcement interviews, all these things are about the insiders. Then we have outsiders, and this is very relatively easier to control because naturally we can see that no unauthorized person is coming in the lab. So there's a local law enforcement, site security, and in all that is looking after the unauthorized people who are coming into the lab. Okay, so okay, we'll skip this. So now today we've learned about the risk assessment. We'll still discuss more about risk assessment in another session. We'll see what are the pre-requirements for the risk assessment committees. So for today, we have known or learned about why we need to make risk assessments, okay? And why we need to make risk assessment? We need to make risk assessment because we need to avoid the risk associated with the release of the organism into the environment. We want to control that organism. We want to stop the organism being acquired by the person who is working. We want to stop the release of the organism into the community, into the environment. That is the whole purpose of making risk assessment. So the biological facility risk assessment provides an opportunity to concentrate resources on the highest risk. So we have grouped the risk associated agents or the biological agents according to 4 risk groups. The one which is providing a lower level of risk is not pathogenic at all. So again, when we take this low level of risk group agent in terms of biosecurity also, or when it is used maliciously, it will not provide any threat to the community or the individual because it is not pathogenic. On the other hand, if we take the extremely risk group agent, that is a risk level 4 group agent, that is providing a high risk to the person and the community. Why? Because it's causing such a disease or infection that does not have any treatment available, no vaccine available, and that organism is not characterized at all. So we are talking about the exotic agents like the Ebola, like the coronavirus right now. So all these are the high risk group agents. And we need to make risk assessments before working on any project. We need to make risk assessments or before approving any project. So we need to propose any project in such a way that it is not associated with a number of risks which we have discussed today. So there are certain risks which are unforeseen, or we are not aware of those risks. It can happen accidentally, and there are certain risks which we already can foresee or we can predict before working that this might happen. So we take precautions before working, like we use PPEs while working in the biosafety lab. So these are the things which we have discussed today. And as I told you, I would provide you some written material about the biosafety cabinets and also risk assessment. It's just that university is closed right now, and my documents are in my office. So whenever I go in a couple of days, I'll just fetch those documents and provide you a scanned copy of that. So I don't have a soft copy. The reason behind the fact is I don't have a scanned copy. So I'll just send you the recording of this lecture. And if you have any questions, we can have another session to discuss more about it. Thank you so much.